largely refined carbohydrates, very high on sugar, very high on salt, very high on fats, including trans fats. So these things we know from literature. But we should also know there is something called as non-communicable diseases. And according to World Health Organization, NCDs, non-communicable diseases, are the new global epidemic. It's increasing every year now. So in 2008, about 57 million people died. Out of that, 2/3 died because of non-communicable diseases. And if you look at the breakup of how people died due to non-communicable diseases, you find that about 40% died because of cardiovascular diseases, 27% because of cancer, 30% because of respiratory diseases, 4% because of diabetes. So that's the chart for death due to non-communicable diseases, NCD. But WHO also says that unhealthy diet is one of the key causes of the growing global burden of disease, especially non-communicable disease. So changing diet, which is low in nutrition, high on salt, sugar and fats, is directly related to these diseases. And this characteristic, low on nutrition, high on salt, sugar and fat, is what junk food is all about. So junk food is directly related to non-communicable disease. Let's look at salt. WHO very strongly believes that and recommends that we must restrict our salt consumption because salt is directly related to hypertension and cardiovascular diseases. And the recommendation is not more than 5 grams per day. Our own National Institute of Nutrition, Hyderabad, says you can eat 6 grams because in India we are a hot country and we lose salt from sweat. So we can eat 6 grams. We have a salt problem in this country because about 40% of population in this country eats above 10 grams per day. In fact, there are states where average salt consumption is as high as 30 grams. What the world is doing about salt? There is a huge concern about salt. Britain has a public health campaign on salt since 1994. They have a target to reduce salt, and in fact now they find that if they reduce salt, it reduces blood pressure in the population, it reduces preventable death, it also reduces health costs. So there is a lot to learn from what the world is doing to reduce non-communicable diseases by controlling what we eat. Fat, as I said, junk food is about salt, it's about fat. There's a clear link between saturated fat and trans fat with heart diseases and also with diabetes. Again, WHO estimate is that about 2.8 million people die each year because they are overweight or obese. And obesity is again directly linked to fat and sugar. More fat you eat, more sugar you eat, you become fat, and therefore you have overweight, obesity, cardio, and all other NCDs then follow. What is WHO guidelines on fats? And in fact, trans fats are the worst. WHO guideline is you shouldn't have more than 1% of energy from trans fat, which in grams means you shouldn't have more than 2 to 2.5 grams of fat per day, from children to women to men. Sugar, how much sugar WHO says we should eat? The guideline is that every day we shouldn't be eating more than 20 to 25 grams of sugar. Why should India worry about it? We are a country, it's a very poor country, and why should we, all these things that I've told you about is the disease of the rich. If you're rich, you eat all these things. You don't have food to eat. But the fact is, actually, India has double burden of disease. We are undernourished, but we are also overweight. This is National Family Health Survey, which was done in 2004-05, the third National Family Health Survey, which shows that about 1/3 of women in urban India are actually obese or overweight. And about one in 5 men are obese or overweight in urban India. Rural India is still under control, but that also is changing very, very fast, as a lot of other studies are showing. In totality, in country today, 1 in 8 people are fat and therefore susceptible to non-communicable diseases. And we have data from 1998 which shows that Obesity in women have increased by 4.2% from 1998-99 to 2004 and 5. So we are also becoming fatter and quite quickly. Look at our burden of disease. As I said, we have double burden of disease. Currently, about 50% of people in this country die because of non-communicable diseases and 50% because of communicable diseases. According to Public Health Foundation of India, they report by 2030, about 2/3 will die because of non-communicable diseases. So, we should be worried about non-communicable diseases, we should be worried about junk food, we should be worried about our junk diet. The other fact is that junk food industry, fast food industry is growing at about 35 to 40% annually. So they are really growing very fast. And most of them are controlled by big multinational and big domestic companies. So that's another thing that we should keep in mind. Considering all these things, looking at the health burden, CSE for the first time in India decided we will test what is there in these junk food. They write things on label. We wanted to know actually how healthy or unhealthy they are. What they claim on the label is true or false. So we tested for fat. As I said, non-communicable diseases is about sugar, salt, fat. We tested for fat, total fat and trans fats, salt, and we tested for carbohydrate, which includes salt, sugar. All these reports will be on the website, so you can look at the methodology. We use internationally accepted methodology to test all these things. What were the samples? Everything that we love to eat is on the list, including 4 potato chips, from Lay's to Uncle Chip to Bingo. We took 2 samples of Lay's, and we will tell you why we did. One which was manufactured in December, another which was manufactured in March 2012, the first one in December 2011. 2 Indian snacks, including aloo bhujia, haldiram, and one kurkure. 2 instant noodles, Maggi and Top Ramen. 2 carbonated beverages, obviously Pepsi and Coke. 6 burgers, out of which 3 non-veg and 3 veg, from McDonald's to KFC to Dirilla's. 3 pizzas from top pizza companies. 3 potato fries, again French fries from those companies, and 1 fried chicken from KFC. So we have 23 samples. We looked at total fat, trans fat, sugar, and salt. That's the study all about. Let's look at nutritional guideline. I have already told you what WHO specifies. The specification is very simple and very clear. We should not have more than 5 to 6 grams of salt, no more than 20 to 25 grams of added sugar, no more than 15 to 30% of our energy from fat, which is about 35 to 60 grams of total fat, not more than 2 to 2.5 grams of trans fat, not more than 230 to 350 grams of carbohydrate. That's the nutritional guide. Both WHO and NIN specify this. And we have compared the food that we tested with this nutritional guide.